Okay, today we're going to talk about the muscles in the knee joint. The first muscle we're going to talk about is the gracilis. The gracilis originates on the descending ramus of the pubis, so the inferior part of the pubis, and inserts on the medial surface of the tibia. And we can palpate this muscle with knee flexion. Next we have the sartorius. The sartorius originates on the anterior superior part of the iliac spine, and it inserts just like the gracilis in the medial surface of the tibia. And once again, we can palpate muscle in this with knee flexion. Next, we have the biceps femoris. Just like the biceps brachii, we have a short head and a long head. The long head originates on the ischial tuberosity, and the short head originates on the lower half of the linea aspera on the femur. And both heads insert in the lateral condyle of the tibia, opposite of that of the gracilis and the sartorius. And we can palpate movement in this muscle with external rotation of the knee, so outward externally. Next we have the semitendinosus muscle, and it also originates on the ischial tuberosity and inserts in the medial surface of the tibia, just like the gracilis and the sartorius. And we can palpate movement in this muscle with resisted internal rotation. So that would take going across the body like that. Next up, we have the semimembranosus muscle, and just like the semitendinosus muscle, it originates in the ischial tuberosity, but this one inserts in the, just like the semitendinosus, it inserts in the medial tibial tuberosity. And we can palpate movement in this muscle with knee flexion and internal rotation. Next we have the rectus femoris, and this muscle originates on the anterior part of the iliac spine and inserts in the superior part of the patella, and then also in the tibial tuberosity. And we can palpate movement in this muscle with resisted knee extension, so going forward right there. Next we have the three muscles, the vastus lateralis, intermedius, and medialis. And just by their name, they go across the leg. The lateralis, vastus lateralis, originates on the greater trochanter of the femur and the top half of the linea aspera, and inserts in the lateral patella, so right through here. Next, more medially, we have the intermedialis, and it originates on the upper two-thirds of the anterior femur and inserts in the superior patella and the tibial tuberosity of the patella as well. And next, and more medially, we have the vastus medialis, and it is the whole linea aspera. It originates there and inserts in the medial border of the patella. So we have all three of these muscles that run right here. And we can palpate movement in these muscles with knee extension. The last muscle we have is the popliteus. So stand up for this one and turn around. The popliteus originates on the lateral condyle of the femur and inserts in the medial surface of the tibia. So it runs right across through here. And we can palpate muscle movement in this with internal knee rotation. Yep. And that is it.